Hi there, my name is Mike Pishvaian. I'm an associate professor at Johns Hopkins University, and it's my pleasure today to talk about the relevant updates in GI cancer from ASCO 2023, incorporating some of the data that we've also seen throughout the year. I'm going to talk a little bit about some of the targeted therapies and some of the more practical aspects of caring for patients with GI cancers that have come up in the last roughly 12 months. There's been a lot of exciting progress in the treatment of HER2 positive GI cancers. And we'll start by talking about HER2 targeted therapy for HER2 amplified colorectal cancer, which in many ways has led the way more recently outside of upper GI cancers for how to apply HER2 targeted combinations. So this started a few years ago with the Heracles study of trastuzumab and lapatinib. This was a study that was done in patients who were HER2 positive and KRAS wild type. These patients had all prior standard therapies. And what was found was an objective response rate of about 30%, including at least one patient who had a complete response. This really, I think, in many ways opened the door to the realization that this is a combination that may be very promising for these patients. Not long on the heels of this, although it was published much later, was the MOUNTAINEER study, the combination of trastuzumab and tucatinib. And this combination led to an objective response rate of 52% with a median overall survival of over 18 months. There is an ongoing phase 3 version of this trial that might be very exciting, but this is data that really is something that I'm applying to my patients now. Not to leave out my pathway, even though I don't think it's being used quite as much, is the combination of trastuzumab and pertuzumab, which also showed an objective response rate of about 32%. And this combination is compendia listed for HER2 positive colorectal cancer. And then, of course, the DESTINY-CRC01 trial with T-DXd, a HER2 targeted antibody drug conjugate, also showed significant outcomes, significant benefit for patients with HER2 positive colorectal cancer. For the DESTINY-CRC01 study, the initial presentation had an objective response rate of 45%, but as was seen in other diseases for which the T-DXd was used, there was an interstitial lung disease rate of about 10% in this patient population. At ASCO 2023, Dr. Raga presented an update of the T-DXd trial. And interestingly, this was a trial that was looking at two different doses of T-DXd. And what he presented was that the lower dose of T-DXd, 5.4 milligrams per kilogram, was actually just as effective as the higher dose, with an objective response rate of 38% in 82 patients that were HER2 positive and had colorectal cancer. So there was not a whole lot of discussion on the rate of interstitial lung disease being less. I think it's still very much a risk, but I think this really opened the door that we could use a lower dose of T-DXd in patients with HER2 positive colorectal cancer. The way I like to sequence this, and I think this is a paradigm that has yet to be definitively established, but the way I like to think of it is that patients have several treatment options. And so if they're diagnosed with HER2 positive colorectal cancer, particularly if they're 3+ by IHC, that I would use a combination of either trastuzumab or lapatinib, or now, because it's actually FDA approved, trastuzumab and tucatinib, as per the MOUNTAINEER study. And then when patients progress on that combination, and if they still retain some HER2 positivity, then we would be able to use trastuzumab deruxtecan for patients after progression on trastuzumab and tucatinib. And hopefully that sequencing will actually further extend the overall survival in these two subgroups. And then there were updates also in HER2 targeting for biliary tract cancers. Two trials presented literally back-to-back at the same session. Dr. Pont presented a trial of zanidatamab, which is a novel bivalent anti-HER2 antibody. It's a single antibody that's bivalent and hits both sides, both valencies hit HER2 specifically and suppress its activity. And that drug, zanidatamab, led to a 41% objective response rate in the 80 HER2 positive biliary tract cancers that were enrolled. Dr. Nakamura presented a similar study targeting HER2 targeted therapy, HER2 amplified biliary tract cancer, with let's call it the MOUNTAINEER combination of tucatinib and trastuzumab, and in this case showed a 47% objective response rate. Again, we don't know which combination is really the quote unquote best to use. I think this just presents a menu of options for this patient population. And I think the most important lesson to learn from both of these HER2 targeted GI cancer trials is that we really need to test these patients. We need to make sure that HER2 testing is a standard part of the treatment paradigm or management paradigm for patients with upper GI cancers, biliary cancers, and colorectal cancers at the very least.